I'm Jeanne Tie, a medical oncologist from Peter MacCallum Cancer Centre and Walter Eliza Hall Institute, Melbourne, Australia. The Dynamic trial is a study aimed to investigate how a novel blood test called circulating tumour DNA can be used to direct post-surgical therapy in stage 2 colon cancer. For oncologists, how best to manage patients with stage 2 colon cancer after surgery remains a clinical dilemma, because we know that surgery alone can cure over 80% of these patients. Chemotherapy is currently offered to stage 2 colon cancers with high-risk features, despite the majority not needing or benefiting from it. Therefore, a more accurate way to predict for cancer relapse has the advantages of limiting treatment to those who actually need the treatment, while allowing those who do not need treatment to be spared unnecessary chemotherapy. The goal of chemotherapy when given after colon cancer surgery is to eradicate any micrometastases if it's present. But the challenge is standard CT scan cannot detect these minuscule cancer deposits. The circulating tumor DNA or ctDNA blood test, which detects DNA released from cancer cells, can identify patients who still have microscopic cancer remaining after surgery, and thus a very high chance of cancer relapse if left untreated. The Dynamic study was designed to show that using ctDNA blood test to direct post-surgical therapy in stage 2 colon cancer can reduce the use of chemotherapy without impacting relapse risk. 455 patients were allocated to either ctDNA-guided management, where only those with the positive ctDNA blood result received chemotherapy, while patients with the negative results were observed, or to standard management, where treating clinician decides on the use of chemotherapy based on standard pathological criteria. The main findings were that the strategy of using ctDNA result to inform treatment almost halved the number of patients who received chemotherapy post-surgery from 28% down to 15%. And despite the lower proportion of patients receiving chemotherapy with ctDNA guidance, the likelihood of being alive and cancer-free at 3 years is the same as standard management, which is 92%. We also found that for patients with positive ctDNA results, the chance of being alive and cancer-free is 86.4% after treatment with chemotherapy. For patients with ctDNA-negative result, the chance of being alive and cancer-free is 92.5% without chemotherapy. So in summary, in stage 2 colon cancer patients, ctDNA assessment after surgery allows a more precise prediction of relapse and patient selection for post-surgical therapy. The ctDNA-guided approach can reduce the number of patients treated with chemotherapy without compromising on their relapse risk. And given the favorable outcome in ctDNA-positive patients treated with chemotherapy, this well-defined high-risk subgroup of patients will likely derive substantial benefit from treatment. And finally, patients with a negative ctDNA result has a very low risk of relapse despite not receiving chemotherapy, suggesting that post-surgery therapy is unlikely to benefit this group of patients. Thank you.